Hello, I'm Gintare. I am doing my validation video for term 2, and I will start with my hands washing. I will turn on the sink, rinse my hands, put soap on my hands. I'm going to scrub my hands in between my fingers. Get my nails. I'm going to do this for 15 to 20 seconds. And I'm going to rinse with my fingers below my hands. Rinse thoroughly, and I'm going to dry. Let them drip. Dry thoroughly, starting with the upper part of my hands and then moving down to my fingers. We'll then place this in the garbage, grab a new clean paper towel, and turn off the sink. Alright, we'll then start my head to toe assessment. Andrew.
Hey.
Hi, Andrew. Can you come with me? What time was your appointment for, Andrew?
Is that noon?
Perfect, you're right on time.
Great.
All right, Andrew. We're going to take a walk to the scale. I'm going to get your height and weight. Is that all right?
Yeah, that's good.
Here, step on the scale. Great job.
This is no, we can't both together. We're just gonna start over. It's probably because you blatantly. I know.
I'm just going to keep a step down. And grab your hip. All right, Andrew, I'm going to have you step up and turn to the back of it. Great. All right, you good?
Good.
Sorry.
Plenty of soap.
Hold tall.
You want to lather both sides. Interlacing your fingers.
All right, Andrew, I'm gonna. Okay, 6'1". Great. So you can do your BMI. BMI is 26.4, which is a little over average, but we're in nursing school. It's all right. All right, Andrew. So we're gonna do a little test. Actually, before we start these tests, can I have your full name and date of birth?
Name is Andrew Joseph Barrows, and birthday is 12/12/59.
Great. Thank you, Andrew. And do you take any medications?
No, just a
Any-
multivitamin.
Multivitamin, great. And any drug allergies, food allergies?
No.
Great, okay. Alright, so we're just gonna do a little gait movements, alright? I'm gonna have you walk on your toes. Just take like 3 steps. Little steps is good. Okay, and then on your heel. Great. And then heel toe. Great job. And while you're there, I'm just gonna, can you bend and touch your toes? Awesome job. Patient's hips and shoulders are aligned. My patient walks with a steady, smooth gait. Great, Andrew. I'm gonna have you come back towards me. I'm just gonna come in here. All right. We're just gonna do a couple more stuff for you. All right. Can you bring your arms out to the side? Great. Now rotate them. Good job. And bring them in front. And touch your nose. Good. And back. And your wrist. Awesome. Active range of motion in the upper extremities. All right, and now I'm gonna have you, can you move your leg that way? Great. And then up. Good. And the other one. Good. And up. Great. My patient has active range of motion in the lower extremities. All right, my patient's general appearance is clean, dressed appropriately for the weather, calm demeanor. Great. All right, Andrew, I'm gonna have you take a seat. All right, so Andrew, I'm gonna start with your head, neck, and face. I'm going to inspect. I'm looking for any bumps, lesions, scarring, which are not noted. Great. And before I finish that assessment, I'm just going to grab my patient's vital signs just to get a baseline. So I would go ahead and take my patient's vital signs. All right, now back to the assessment. I was assessing the head, face, and neck. Looking for any abnormalities, any masses, any bulges. There are no obvious signs of, no obvious abrasions. Good. All right, now I'm gonna palpate the head. Feeling for any bumps. Head is hard and smooth. Hair is black, short, evenly distributed on the scalp, and it's clean. Great. Good. I'm going to palpate the lymph nodes, the pre-auricular, the post-auricular, the maxilla, mandible, the supraclavicular. I'm going to palpate the trachea. Trachea is in midline. No lymph nodes or thyroid gland palpable, which is within normal limits. Great. All right, Andrew. Next, I'm going to look at inside of Andrew's ears. Alright, ears look good. No drainage, no cerumen. Extra cerumen noted. I'm just going to palpate the pinna. Pinna is soft and smooth to the touch. No lumps, no hard lumps, no abnormalities. Great. All right. Now I'm going to look at your eyes. You're going to look at my nose. Okay. I'm just going to take a look at the other eye. Good. I'm just going to look at my nose. Okay. Okay. All right. Now I'm going to have you look at the tip of my pen light. I'm going to bring it halfway. And I'm going to bring it all the way to your nose. Good. Patient's eyes are equal, pupils are equal, round, and reactive to light accommodation and convergence. All right. Now we're just gonna check your extraocular eye movements. All right, Andrew?
Sounds good.
So you're gonna look at my pen, and I'm going to move the pen in distances. So you're just gonna move your eyes. All right? Good. Eye movements are smooth and even in both eyes. All right, I'm just gonna look in your nose. I'm gonna look for any drainage, any inside of the nostrils are pink and regular. I'm just gonna have you close your nose and blow. And this, great, even airflow distribution through the nares. And I'm just gonna have you open your mouth. And can you say ah? Great. Uvula and soft palate move up and back. Great. And the inside of my patient's mouth is pink and moist, which is exactly what we want to see. And all teeth are there and intact, which is great. All right, Andrew. Oh, Andrew, I totally forgot to get your waist circumference. So could you stand up again? Great, thank you. All right. Which is 38, which is within normal limits for a man, which is greater than 35. All right. Okay, we are going to do your respiratory assessment. I'm just gonna have you sit down, okay? And can you just take your shirt off for me, Andrew?
Yeah, sure.
That's great. Thank you. No, we're just gonna set.
Oh.
All right. So I'm going to start with inspecting my patient's chest. I'm looking for any chest barrel chest, which is not present in my patient. My patient is not using any accessory muscles to help him breathe. No flaring of the nostrils, which is a great sign. My patient is in non-distress. All right, Andrew. Now I'm just gonna palpate for landmarks, all right? Great. Just going around back. Back looks good. I don't see any lesions noted. I'm just gonna. Great. Okay. Next, I will percuss the chest. Great. We hear right there is resonance, which is exactly what we want to hear in
Good.
percussing the
That'd help you,
chest.
huh?
Exactly. All right. Next, I will auscultate your lung sound. Okay?
Yeah.
Is that all right, Andrew?
Let me know how they sound.
I will. All right. So I'm gonna start up here, and we're gonna take some slow deep breaths with open mouth. Great. Now I'm just gonna go to the back and listen for his. And some deep breaths with your mouth open. All right, my patient has clear lung sounds, no adventitious breath sounds. Okay, so next, we're actually gonna do another little test with you standing up. Is that all right?
Yeah.
Great, okay, you're healthy and on the go. Okay, so this test is for your balance. So what you're gonna do is put your hands to your sides. Great, and I'm gonna have you close your eyes, and I'm just going to stand behind you and assess your balance, okay?
Yeah.
Romberg test is negative. You have great balance, Andrew. All right, so I'm just gonna have you sit right. Actually, you could stand right up here. Yeah, so I'm just gonna check your vibrations from your lungs, see what you got here, all right? So what I'm gonna have you do is kind of turn this way for me, and I'm gonna have you repeat 99.
Okay. Let me know.
And you can say it now.
99.
Great. And again?
99.
And one more time.
99.
Awesome. Vibrations are strong and equal, bilateral. Loudest on top to the lowest. All right, now I'm just gonna have you take a deep breath in. And great. Thoracic expansion was great. Thumbs moved at least 1 to 2 centimeters. All right, now we're gonna do your cardiac assessment. And that consists of you laying down.
Okay.
So for the cardiac assessment, I want my patient to be at a 45-degree angle. so I'm going to first inspect my patient's precordium. Precordium, there is no lumps, masses, no heaves. Precordium looks great. All right. So then I'm going to palpate my patient's chest. I'm going to look for landmarks. So I'm going to find my aorta, which is in the second intercostal space on the right sternal border. And then I would palpate the pulmonic, which is in the second intercostal space on the left sternal border. I would then go to Erb's point, which is in the third intercostal space on the left sternal border. And then we're going to go to tricuspid, which is the fourth intercostal space on the left sternal border. And then I would then go to my mitral pulse, which is the fifth intercostal space, mid-clavicular line on the left sternal border. All right, now that I've palpated my landmarks, I will then auscultate my patient's heart sounds. And then we'll listen to the apical pulse for 1 full minute. Once I finish listening to the apical pulse for 1 full minute, I'm going to turn my stethoscope around and listen to all heart sound points with the bell. I'm listening for any extra heart sounds, murmurs. Great. No extra heart sounds or murmurs noted present in my patient. While I'm here, I'm just going to do a little skin turgor. Skin turgor is good, non-tenting. All right, I'm still in my cardiac assessment. I'm looking for JVD, which is jugular vein distension, which is not noted. None present. And then I am going to listen for brewing with the bell in the carotid artery. And then in the aorta. No brewing present in my patient. All right, Andrew, your cardiac assessment is great. Great heart.
Oh, good.
All right, now we're going to move down to your abdomen.
Okay.
All right, so I'm going to lay you down flat, all right?
It's nice and comfortable.
So while I have you laying down, I'm actually going to check your pulses and then some cap refill, okay?
Okay.
All right, so I'm gonna check my patient's pulses. We're gonna do the temporal pulse, which is at the temporal artery. The carotid pulse, which is at the carotid artery. But make sure you do that one at a time or you can restrict blood flow to the brain. We don't need that. Carotid pulses are strong, equal bilaterally, and palpable. I would then go to the brachial. Brachial pulses are strong, palpable, equal bilateral. Then I'd go to the radial. Radial pulses are strong and equal bilaterally. Now I would go to the popliteal. You can put your legs down, sir. Thank you. Popliteal pulse is palpable, strong, and equal bilateral. Then I would go to the posterior tibialis. posterior tibialis is palpable, strong, and equal bilateral. And I would go to the dorsal pedi. Dorsal pedis is palpable, strong, and equal bilateral. Great, you have great pulse. Okay, and then just do a little. Great. Babinski reflex negative, which is exactly what we want to see. Awesome. All right, I'm just gonna have you lay down. We're gonna do your abdominal assessment.
Okay.
All right, so I'm gonna inspect the abdomen. I'm looking for any distension, any abnormalities. Patient's abdomen looks great, and as I have my patient laying here, I can assess the skin, which looks fabulous. It's warm to the touch, smooth, clean, perfect. All right, Andrew. Now that I've inspected your abdomen, I'm going to listen for bowel sounds, okay? Is that all right with you, Andrew?
Sounds
all right.
good.
All right, I'm going to start in the right lower quadrant, and I'm going to listen for 5 to 35 clicks per minute, gurgles, clicks per minute. If I do not hear any, I will listen to each quadrant for 5 minutes, for a full 5 minutes until I hear bowel sounds. Great, bowel sounds present in all 4 quadrants. All right, now, next I'm going to percuss. What we hear when I percuss your abdomen is timpani, which is a good sound to hear.
Good.
All right, next I will move on to palpation. I'm gonna do light palpation, which is 1 centimeter, and then deep palpation, which is 1 to 2 centimeters. If you feel any tenderness, you just let me know.
Okay.
Any tenderness when I remove my hand?
No, it feels good.
So rebound tenderness is negative, which is great. Great. No tenderness, abdomen looks great. All right, so now I'm just gonna do some, I'm just gonna have you uncross your legs for me.
Oh, good.
And can you push your feet towards you? Whoa, you have great strength. And gas pedals, great. And lift your leg up, good. And the other one, great. All right, my patient has equal bilateral movement strength in lower extremities. All right, I'm going to bring the head of you down. And my last exam, we're just gonna test some nerves, some cranial nerves.
Whoa.
All right, does that sound good?
Yeah.
All right.
Excited.
I don't know if you know about those, but I'll teach you a little lesson about them.
Yeah.
All right?
You know what's going on.
So I'm gonna have you like sit.
Sit here?
Yeah.
Sure.
So we're gonna do a little we're gonna make some faces. All right? How's that
Okay,
sound?
yeah.
All right. So first we're gonna puff out your cheeks. Great. And can you stick out your tongue? And move side to side. Awesome. All right. And I'm going to have you shrug your shoulders. Whoa. And can you move your head side to side? Great job. All right. And cranial nerves 2 through 12 are intact. All right. I have finished my health assessment, and my patient is in overall good health.